surge, we're at a 20.4% positivity, which is quite high for us. And we have reached some of the highest numbers this week for inpatients currently today at 146 patients hospitalized specifically for COVID-19. Next slide. I want to share with you this new slide. You've probably seen similar slides from other healthcare organizations. And this is a reflection of the patients that are hospitalized for COVID-19 across the Munson healthcare system. So this does not count people who were just tested positive pre-procedure or who were admitted for a different reason and happen to also test positive. These are people specifically in our hospitals with COVID-19. The other thing you can see from here, despite our high numbers, are how many of those patients are vaccinated versus unvaccinated. And so we are counting here for vaccinated those who have completed a 2-dose series for the mRNA vaccines or 1 dose for the 1-dose vaccine. But you can see both in our hospitals as well as in our ICU, definitely a predominance of admissions for unvaccinated patients. And then when you get to how many patients are on a ventilator with COVID-19, you can see there, of the 9 on a ventilator, none of them are vaccinated. So again, this is just a reflection of all of our Munson healthcare hospitals across our Northern Michigan region. Next slide. I wanted to share this data as well. This is from the state of Michigan, and you can see those fluctuations and color-coded graphs there. And I just wanted to share on that right side, you can see that blue line. That's a reflection of cases in our 10 to 19-year-olds. And underneath that, you can see some other younger populations in the 30s and 40s, and then our 0 to 9-year-olds. That surge in our 10 to 19-year-olds does coincide with the start of school. You can see that they still continue to lead in our new cases. So just a reminder of where we are, and while we are seeing a rise from all age groups, you can see that highly vaccinated age group of the 70 to 80-year-olds is the lowest in new cases. So certainly, I think a correlation there between being vaccinated and new case numbers. Next slide. I want to also address some questions that we get about breakthrough cases. And so when we're reporting those cases at the hospital level, that in no way reflects how many total patients we're looking at. So when you look very broadly at all the population of who's vaccinated and who had breakthrough cases, from the state, it's approximately 2% of people who are fully vaccinated that have a breakthrough case. And then of those, a very small percentage are hospitalized. So while no vaccine is 100% effective, and we've certainly seen that with other well-known vaccines that have been around for decades, your chances are significantly reduced of being ill or hospitalized if you are vaccinated. So just a reminder, based on the data that we see, that vaccines are still the best way to protect yourself and others from COVID-19. Next slide. So one of the things that we have been talking about throughout this pandemic is how you can help. We started out by flattening the curve. We have been having multiple conversations through our press conferences. We have lots of good videos and other data and information on our social media sites and on our website. But one of the things outside of vaccinations that we'll talk about in just a minute is going to the right place for care. So we've shared with you, we are seeing record numbers of patients being hospitalized for COVID. We're also seeing high numbers of people hospitalized for other reasons. And so when you're looking to seek care, it's important that you go to the right place for care. So, if you have something that can be treated by your primary care physician, we would invite you to do that rather than show up in an emergency department. If you have a relatively mild emergency and urgent care, might serve you better than an emergency room where you're going to be triaged and where the very sickest patients go. So we just wanted to reiterate for you, there's good resources out there to help you make that decision. We still have our Ask a Nurse line that's available to you. But one of the things you can do to help us is make sure that you help us find the right place for your care at the right time. Slide. And then we've been talking a lot about immunizations, and I just showed you the slide that showed how children are showing us the highest rate of rise in the number of new cases. I think everybody's aware that the emergency use authorization for vaccines has been broadened to include kids age 5 to 11. Many of our pediatricians and other primary care providers across our northern Michigan region are providing that vaccine in their offices. We also have a pediatric immunization clinic in the Traverse City area that's on Wednesday evenings where you can call to schedule an appointment. And then our local health departments are all also offering pediatric vaccination at various places. And then you can also seek care at some of our retail pharmacies as well. There's a great site on the Michigan Department of Health and Human Services website where you can get online and check about availability. You can also go to each of those different organizations to find out availability for vaccination as well. Next slide. And then the next thing is getting tested. So we know that testing is one of the best ways that we can help reduce the spread of this virus. So if you have any symptoms at all, and we hear all the time, wow, my symptoms were really mild, or I just thought it was allergies, or that kind of thing, any kind of upper respiratory symptom, whether it's a runny nose or a sore throat or a mild cough, even just one of those things, but certainly if you have multiple of those things, please go get tested. You can get tested at your local health departments, through your primary care provider, again, through many of our retail pharmacies. You can order tests off Amazon. You can pick them up in our pharmacies. You can get on the Michigan website to find a testing site. There are hotlines and Ask a Nurse lines that you can call. But if you have any symptoms at all, please get tested. And if you test positive, please quarantine, isolate yourself from others so that you don't spread the virus to them. And if you're at high risk for getting seriously ill from COVID, please call any Munson Healthcare facility and ask about monoclonal antibody therapy. That therapy is available throughout the Munson Healthcare system, but it must be completed within the first 10 days of the onset of your symptoms. Next slide. And then again, get vaccinated. If you are already vaccinated, please get your booster. Please continue to mask in school settings and other indoor settings. We have shown over and over again, there are numerous studies as well as our evidence from last year's flu season that masking works to prevent not only COVID-19, but also influenza and other upper respiratory tract infections. So please mask. And continue to practice your social distancing, washing your hands frequently. I know that we've been talking a lot about those mitigation factors for the last 20 months, but they work. And we would strongly, strongly encourage you to band together with us and keep those mitigation efforts in place.
Thanks, Dr. Nefcy. That's a wonderful update, although pretty discouraging to see those numbers continue to rise. We'll ask that you please rejoin us in a few minutes after the other speakers, and we'll do the Q&A session. So thanks, Dr. Nefcy. Before we move on to the health department updates, I do just want to remind you that if you are a reporter and you are logged into this Zoom, you can submit your questions via the Q&A feature. Or if you're joining us on Facebook, you can submit your questions via Facebook, and we'll get to as many of them as possible as our time allows at the end of the panelist presentations. So without further ado, it is my pleasure to welcome back Wendy Hirschenberger, who is the health officer with the Grand Traverse County Health Department. As a reminder, Wendy does not have video capabilities, so she will be joining us by audio today. Welcome, Wendy.
Thank you. Good morning. So we'll start out with what our trends have been. I actually pulled some trends for the last month. So transmission in Grand Traverse County remained very high, with the last 3 weeks seeing our highest transmission rates yet. In the last 30 days, we've had 1,964 newly identified cases and 28 deaths. So that collectively was our worst month throughout this entire pandemic. And our monthly case average is 65 cases a day for our county. Our percent positivity statewide is at 20%, and Grand Traverse County is not far behind at 19.2. And that has been a 5-week increasing trend for us as well. So like to see those numbers come down. Statewide, the deaths have also been increasing for the last week or two, and the same is true with our county deaths. And definitely this is, the largest and most serious COVID surge we've experienced in Northern Michigan since the pandemic started. So again, repeating what Dr. Nefcy talked about, and then just the CDC and state health department have both put out advisories about wearing face masks when in public settings, regardless of your vaccination status, due to those high transmission rates. Next slide, please. This is just showing our progress with vaccinations overall for our county. We're at over 72% for initiation, just under 66% completion. And then you can see the breakout by age group. We continue to make progress on the 5 to 11-year-old population. We're at just under 28%. Statewide, I think, is 16%. But we do have some work to do in the 5 to 39-year-old groups. So we continue with the vaccination clinics as well as the booster clinics. Next slide, please. So this slide shows vaccine for ages 5 to 11. Again, those vaccines are done at the Maine Health Department on the Franier Road. We are booked for this week, as we have been for the last 3-4 weeks. We continue to book up very fast, but we do release our appointments every week on a rolling basis. So this week we will release them at 10 a.m. on Wednesday, which is our normal time. So make sure to go to our website or our Facebook to get the link. And we will be vaccinating 4 days next week for the 5 to 11-year-old population. Next slide, please. Just a reminder that anyone over the age of 18 is eligible for a COVID booster if it has been 6 months since you completed the previous series or shot. So we do encourage that. Dr. Nefcy talked about the talking points about it continues to be very highly effective at reducing risk of severe disease, hospitalization, and death. And given the 2 slides I just talked about with our high immunization rates, I would really hate to see what those numbers would be like in the hospitals if we didn't have so many people still getting vaccinated. And then again, the breakthrough rate for infection, we get asked this, for the COVID vaccine still remains very low at 2% for the state of Michigan. Next slide, please. This slide shows our vaccination clinic for those who are 12 and older. So again, this is first and second doses as well as boosters. This is our Cherryland site, and we are doing what we can to increase the number of days we're vaccinating. So this week and next week, we're vaccinating Monday through Friday at various times, as well as Sundays. We continue to work to try and partner with HANU and the National Guard to see if we can even, expand some of those. So do check our website for appointments and our Facebook page throughout the week if we expand the offerings. Next slide, please. And this slide is just a reminder of all the different mitigation efforts that everybody can do just to try to protect yourself and your family and have a safer holiday season. Again, get vaccinated or get your booster, continue to wear a mask, wash your hands. If you can, space out and improve the ventilation in the rooms you're going to be in if it's a larger group for a holiday thing. Talk with your guests in advance about what your, sort of ground rules are for COVID, so people are aware. If you are sick, make sure you don't show or you cancel the plans. It's really important that you stay home and isolate if you're sick, and if you're supposed to be in quarantine, it's important that you stay in quarantine as well. Next slide, please. This is just a reminder for anyone who's doing home testing, if they receive a positive test, to please report that so we can follow up with you and ensure that you have the resources that you need, including information on the monoclonal antibody referral and notifying any close contacts about isolation and quarantine as well. Last slide, please. And then this is also just a reminder that we are in flu season as well. We have seen an increase in the state of Michigan of cases of influenza A. It's the H3N2 activity. Many people have probably heard about the University of Michigan outbreak, but there are other cases throughout the state of Michigan as well. And it is important that everybody get their annual flu shot. And it is the best way to protect yourself. Also a way to prevent serious illness and hospitalizations and death. So again, this would help with the hospitals as well, with the influx of people who are ill. That's all I have for today. Thank you.
Thank you, Wendy. Appreciate that update, and thank you again for all the incredible work that you and your teams are doing for the Grand Traverse region. Next, it is my pleasure to welcome back Dr. Jennifer Morse, who is the Medical Director of District Health Department number 10. Welcome back, Dr. Morse.
Thanks. All right, so we have seen a slight decrease in our averages for our percent positivity in our cases. However, our amount of testing that was done over Thanksgiving and the holiday weekend went down about 10 to 30% in our area. So it's hard when looking at the weekly averages, looking at our day-to-day case rates over the last several days, we're at about the same levels as we were seeing pre-holiday. So likelihood our averages are low because of that decrease in testing for those few days. But again, on average, we've seen a slight decrease over the week. So still very high though. So we have successfully set up several community testing sites doing rapid antigen testing and PCR testing when it's appropriate. We have a site in Big Rapids that has tested close to 1,000 people so far. The average test positivity is just about 25%. Kalkaska has hit 1,800 individuals tested, and their percent positivity is right around 28%. Newaygo has tested just over 1,900 people, with nearly 29% of those people being positive. A site in Cadillac has started testing yesterday, and we expect Ludington and, the Ludington site will start next week, and Oceana should be starting soon. So that has really helped to get additional testing available in our areas. Those sites are listed on a calendar that is available at dhed10.org/events. Not listed here. There has been a site at Kirtland Community College in Grayling for quite some time. They also provide vaccination there as well, and they have just extended that now to start vaccinating individuals starting at age 5. So their hours are from 10 a.m. to 5 p.m. on Tuesdays, Wednesdays, and Thursdays. So again, they provide both testing and vaccination for all age groups that are eligible now for the COVID vaccines. So that's a good to know. Next slide, please. So this is just our vaccination rates. This resource does a nice job of providing a zip code level data just to show the variability. But at this time, they can only show us ages starting at 16 plus. So this is for the age groups of 16 and above, showing those that have completed their vaccination, initiated and completed their vaccination. I'm trying to see which one she's showing here. This is showing the initiation rate in the color. So the more pink that it is, the lower the vaccination rate. The lightest green is 50%, going up from there as it gets darker green. We've had 57.5% that are eligible and over 16 that have initiated a vaccine and 52.5% that are over 16 that have started a vaccination series. Again, that does not include a booster dose. That's just the primary series. So as you can see, we do have some pockets that still continue to have very low vaccination rates. We continue to vaccinate our 5 to 11-year-olds in our offices. Our overall average vaccination rate is 8.5%, which is about half of the state average. So we really encourage those parents to get kids in to get vaccinated, especially before the holiday season hits, as we all get together and start gathering so that they're not spreading illness to grandparents and other adults that may be at high risk. We also have added a reporting option, like Wendy was talking about, on our homepage, dhed10.org. Right at the top of the page is a button people can click to self-report positive home antigen test results, so that those can be reported and we can follow up on them as indicated. So again, our events website has clinics in the community as well as testing events in the community. We have more information on our vaccine page, as well as self-scheduling for flu and COVID vaccine. And then further information is listed there. So I believe that's all I have for today.
Thank you, Dr. Morse. We'll have you back in a moment for the
Okay.
Q&A session. And lastly, I'd like to welcome back Heidi Britton, who is the CEO of Northwest Michigan Health Services. Welcome back, Heidi.
Thank you. Thank you for having me today. So at Northwest Michigan Health Services, we're still trying to make the vaccine as easy as possible for folks to get, providing lots of opportunities. Continue to work with our farms, the wineries, the businesses for pop-ups. But at this point, we're not doing any business pop-ups due to the high number of boosters that we have been requesting, as well as other age groups. We're keeping just to our curbside as well as appointments only. So although I think that this slide might be a little bit older, there are no walk-ups right now at this point. We got inundated with walk-ups. And so we're just going to keep it down to appointments only. Like the health departments, we post our opportunities at the beginning of the week or weekly so that you can keep checking back often. Also for testing, we're testing for our patients. If you're a patient of NMHSI, we will go ahead and have you have a visit if your provider asks for a test to be done. So the message that I'd like to send is that it's awesome how much uptick we're having on how many folks are coming out for boosters or first time dosing. And that we want to continue to facilitate that, and that we'll be doing that via appointments at this time instead of walk-ups, just to manage and make sure that we have the best safety that we can for our patients and for our staff. Thank you.
Thanks, Heidi. And now we'd like to welcome back all of our guest speakers, and we will begin our Q&A session. And Dr. Nefsey, I'm just going to warn you that the majority of the questions today are related to our hospitalization numbers and for you. So I'll try to sprinkle in a few others for the health departments as we receive them. So the first question is, let me find it here. Have we lost any employees due to the vaccine mandate, and how many? And I believe your deadline to receive the vaccination for the exemption was yesterday. And actually, I can get started and just answer that question. Dr. Nefsey, you can follow up with any additional comments. So Munson Healthcare is really pleased to announce that we expect to be at a 99.8% compliance rate. As of yesterday, we only had approximately 20 resignations due to the vaccine mandate. That's out of 9,000 employees. So we were fully prepared for that. And I think this just goes to show you that when you work in healthcare, you expect to be vaccinated for things like influenza and MMR, and many healthcare workers, saw the COVID-19 vaccine as another way to protect themselves. So really happy to see those numbers. I know we were hovering around a 70% range there for a while, and when we decided to accelerate our date for the first dose of a 2-dose series, or the full completion of the Johnson & Johnson 1-dose series by December 5th, we started to see a really strong uptick in those numbers. 1 week we saw a 4% increase, the next week we saw a 7% increase. So we're still following up with a few individuals who work part-time, who are not scheduled to work. As they come back to work and get them on the schedule, we'll confirm their vaccination rates. But really pleased to see such a high rate, and that's really good for healthcare in Northern Michigan, because that means we're staffed and ready to support our communities. Dr. Nefcy, any other comments you'd make on that?
No, I think you covered it well.
Okay, great, thank you. So Dr. Nefcy, how many people is Munson seeing that are COVID-19 positive that come through our emergency room that are not serious enough to be admitted? Are we still seeing a high number of people coming through, but maybe not being admitted for hospitalization rates?
Yeah, we do still see a lot of people come in through the emergency room for testing and for evaluation. I don't have the numbers on that. We are also trying to encourage people to be seen through their primary care physician and through our urgent cares. So hopefully most of the people that are really sick are, being reserved for the emergency room. I don't have the numbers on that. I can just tell you that our emergency departments as well as our urgent cares are quite busy.
Thanks, Dr. Nefcy. The next question is for you as well. What is Munson Healthcare's capacity for COVID-19 patients? 146 is about 50% higher than records from April. How many more can you care for?
Well, it's a good question. Early on in this pandemic, one of the limiting factors was really our number of ventilators. That does not seem to be the issue now. We have much fewer of the percentage of the COVID positive patients who are on a ventilator. So that's not really an issue for us. It's really staffed beds, and we've been taking a lot of different steps, doubling people up and stopping some of our elective procedures or postponing them till later so that we can accommodate more beds, so that we can keep taking them. We are not in any danger right now of turning people away, so to speak. We continue to make the adjustments that we need to across our entire system to ensure that we can take care of not only those patients that need to be admitted for COVID, but anybody that comes in through our doors that needs care.
Thanks, Dr. Nefcy. One more question for you. What is the average length of stay in a hospital for COVID-19 patients? And there's another follow-up question after that.
It's a good question. Certainly, the sicker you are, the longer your length of stay is. So we've seen overall our length of stay increase slightly because of the large number of COVID patients that we're having. Taking a rough guess and averaging it out, which isn't really very accurate because there's wide ranges of how ill people are. I'd say 5 to 7 days. But certainly we have some that are much longer than that. If you're intubated, it's going to be much longer than that. And then other ones who recover relatively quickly.
And one last question for you. Is monoclonal antibody therapy the only treatment? If not, what else is used for treatment?
Well, so I would say monoclonal antibody is for a select number of patients. So it's for patients who have tested positive but aren't ill enough to be hospitalized. And so we use that to treat high risk patients on the outside. So they don't get admitted to the hospital. They are not sick enough that they need hospitalization, but they have a high risk based on their health or age or that kind of thing. So that is an outpatient treatment that we're providing for patients. The people that get admitted, it's varied. So oxygen is always a therapy for those people who are admitted. We have some other drugs that we use. Steroids are relatively common. But for an outpatient treatment, really, the monoclonal antibody right now is all that we have. We are expecting some broad authorization of pills that people have probably heard, an oral therapy. You know, the initial news on those was a lot more positive than what we're hearing now. And it does look like there might be some supply chain issues with getting that drug available, you know, widely. But right now that's not an option for us. It's just something that we're looking for hopefully in the new year.
Thanks, Dr. Nefsi. This next question is for Wendy. What is the current understanding of the risk posed by the Omicron variant?
That's an excellent question. I think we're continuing to learn as more cases pop up in the United States, in particular, where we can track transmission. From the most recent things I've read, it says that it might be more highly transmissible than previous variants, but may result in less severe illness. So I guess time will tell. We'll continue to monitor and just keep doing the mitigation strategies that we're doing for the other variants.
Thank you, Wendy. This next question is for Dr. Morse. Are there any estimates as to the percentage of people who've been vaccinated who have received a booster shot?
No, I actually just looked for that late last week, and I can't really see that there's any updated like real world experience or data on that that's new in the US. I'm sure once that's available, it will become widely publicized, but I think we're just too new into the boosters to have anything new that's not already been publicized and that we're well aware of.
Great. Well, we'll make a note of that and continue to monitor that. When that data is available, we'll be able to more publicly share it. Dr. Nefsi, are you able to distinguish among the hospitalized patients which are infected with Delta variant?
Yeah, you know, that testing is done at the state level. And so the state tests about 8,000 samples every week for new variants. The most up-to-date data we have still shows that the vast majority of cases that we're seeing, like 99% of the cases we're seeing in Michigan, are the Delta variant. We haven't yet identified the Omicron variant here in Michigan. I think most of us believe it's just a matter of time, but right now it's Delta.
Great, thank you. There are a lot of questions coming in. Heidi, I'm going to ask you this one. Can you recommend a communication strategy for addressing concerns with people who still think that COVID-19 is a hoax or only a cold? I'm struggling with this puzzle.
I thought you were going to give me that one, and I thought, well, I'm going to shift that one over to Miss Wendy. Wendy, what do you got from the health department? That's a health department, great health department PSA and messaging, but I think it's better suited for the health department.
Could you repeat the question? I'm sorry.
Sure, sorry to throw that one at you, Heidi. Sure, Wendy, can you recommend a communication strategy for addressing concerns with people who still think that COVID-19 is a hoax?
Oh boy. I think we just keep, speaking what the science says and showing what the data says, and that's kind of all we can do. There are going to be, other influences that affect people and their opinions, but ultimately we just have to follow the science.
And Wendy, was there a spike in cases following Thanksgiving? I think what we saw from the hospital standpoint was that the number started going up within a week after Thanksgiving. And I think we typically see that's within 2 weeks.
Yeah, so I would say that our numbers, at least for our county, remained stable, but stable was still very, very high. And we're still seeing, we'll still see the effects of Thanksgiving the rest of this week as well. I just want to circle back to the previous question. One of the things is just to tell people to make sure they're checking the source of the information. That's really important. Don't just read a headline and believe everything you see or hear. but really make sure that it's a credible source for the information.
All right, thank you. There are a ton of questions coming in, so I'm trying to sort through them here. Dr. Nefsi, I've heard patients are staying longer in the hospital. How much longer, and what do you think some of the reasons are? You mentioned that a little bit earlier where we tried to average out the length of stays, but what might be some reasons patients are staying longer?
Well, I think there are two. You know, when we look at it globally, we're kind of putting things all together in a lump sum. So we have some of our hospitals where over half of the patients are COVID patients. So whereas in the past we might have people in there for, you know, a quick knee replacement or something that only needed treatment for a couple of days, when you have the vast majority of your patients there for COVID, those are typically longer admissions, much more intensive admissions. I think that combined with the fact that we are really admitting only the most sick patients, you know, many of those things that might have been a quick admission for either like an elective surgery or something mild that's now being treated at home, those just aren't driving the numbers down. So we've just got a lot of COVID patients and very sick patients. And so by definition, their length of stay is longer.
And Dr. Nefsi, is the hospital system still in pandemic level red? And what is the impact that that is having? And are surgeries being postponed?
We are still in red. We are very red, just like many of the other organizations across our state. And basically, our teams are making day-to-day decisions, you know, in coordination with surgeons and other physicians about which are the cases that can be most safely postponed and which really need to happen urgently. And so I'd say you know, the level of that work and those daily conversations are one of the things that's most different. You know, we also adjusted a little bit, you know, things like our visitation policy, you know, our work from home got extended. You know, there were a lot of other things that, you know, might not be public to or visible to the public that are there. Many of our staffing considerations, you know, affected things like our cafeterias being broadly open. So, you know, we're obviously still providing food for our inpatients, but many of our hospitals, for staffing and safety reasons, are no longer making their cafeterias available to the general public. So there are, you know, a lot of things like that. We all still continue to mask and do our daily testing. You know, we all screen ourselves before we come into work every day. You know, just a lot of the same stuff that we've been doing.
Thanks, Dr. Nefsi. I'd like each of the health departments to comment on this. I'll start with Dr. Morse. What is the flu looking like this year so far? And are this year's vaccines holding up, or is it too early in the season to tell?
Well, so far it seems like a traditional year, but we don't really know what is going to happen because it usually peaks around February or March. But we have already had that large outbreak at U of M. In that outbreak, about 20, I think it was 24, about a quarter of the people that were infected were vaccinated. So 3/4 of those that were infected were not vaccinated. But it is really too soon to know what kind of a match we're going to have. There isn't much data on that yet. We do know that our vaccination numbers for influenza are lower at this time of year, as they usually are at this time of year, and behind where we'd like to see them. It's not too late to get vaccinated. Even if you've already been infected with flu, it's never too late to get vaccinated because you could still get exposed to a different strain. There's 4 different strains in the vaccine. We're really, at least I am, and I know many are very worried we're going to have a bad influenza season. And if you add that to the COVID season or the COVID situation we have right now, you know, you imagine the hospitalizations from influenza added to what we're dealing with right now with COVID. So again, it seems typical right now. We don't know what the vaccine protection will be like, but you still have time to get vaccinated. I did want to really quickly, for that person asking about the misinformation, there is one website, there's a ton of them, but one I think of off the top of my head is publichealthcollaborative.org. they have a lot of good resources, and they have a good newsletter they send out with resources on how to address misinformation about a lot of those things. So
Thanks, Dr. Morris. And Wendy, is there anything additional you'd like to add about the flu?
I think Dr. Morris covered it all, except I would say that the mitigation efforts that we discussed that work for COVID also work for the flu. And that's why we had a fairly non-existent flu season last year. So keep washing your hands and doing all the things that we've talked about to mitigate viruses in general.
And Wendy, can you comment on the local death rates? Have the death rates increased in the last month, and what are the demographic trends or differences you might be seeing now?
I don't actually have the death rate, so that's calculated a little bit different. I can tell you, just since the pandemic started, though, we've not seen 28 COVID deaths in a 30-day period. So I know that those numbers are higher. I also just happen to know we're seeing an increase in the number of deaths to some degree in our county as well, not just COVID related, just through my work with the medical examiner's office. And I would say that anecdotally, based on my memory, that majority of the deaths that we're seeing are unvaccinated.
Dr. Morse, anything else to add there in your area?
yeah, I don't have hard numbers in front of me, but and I cover a really large territory, so it's hard for me to single out any one county, but we seem to get quite a few deaths. Some of, the small counties will get 4 or 5 a day, just in clumps. And, we were just discussing this morning on a call that the age seems to be a lot younger than what we had seen in previous surges. So a lot of 30, 40, 50-year-olds. Still seeing 80, 90, even I recall a 100-year-old. But again, just a lot of really young people. So just really gut punches on those deaths. But yeah, the death rates or the number of deaths have been really disturbing. And I just think, there's just not a lot of awareness about that, perhaps. We've had people dying in the home who never go to seek care. So,
yeah, that's very sad. Thanks, Dr. Morse. And I think we'll do whatever we can to continue to get that information out and make sure that people seek care when they need it. It is very discouraging numbers. Dr. Morse, one last question for you. I've heard RSV is quite bad this year. The numbers are obviously higher than last year, but do we know how it compares to pre-COVID years? Have you seen an increase in RSV in your area?
We definitely have had more activity, and it's a little bit earlier than what you might typically see. Again, without mitigation measures like we had last year, we're seeing, to me, it's a more traditional year. Now, Dr. Nefsi, being a pediatrician and working more in the healthcare field directly than I do, may have a better idea of that. But to me, it was a more typical year compared to last year where we saw none, because everybody was, sequestered and masked and things like that. It may have been a bit worse just because we went a year without. And so those infants last year weren't exposed. So they, were more susceptible this year. So I would see what Dr. Nefsi, if she has anything additional to add to that.
No, I would agree. I think it was fairly traditional. I do think that we probably had some increased numbers of patients susceptible because we didn't see it last year. And I just think we noticed it a lot more and commented on a lot more because of the state all of our hospitals are in across Michigan, so it just impacted us more than it would typically. But we almost always in pediatrics see an increase in our number of hospitalizations in the wintertime because of RSV and influenza.
And Dr. Nefsi, the last question for today, and unfortunately we're just out of time, but is the uptick or the more traditional year of RSV causing an increased number of patients in our hospitals? And could you just remind people about Munson Healthcare's ability to treat pediatric inpatients.
Yeah, so we do not have a pediatric ICU in any of our Munson Healthcare hospitals. So, and not all of our, excuse me, not all of our hospitals admit pediatric patients. So those sickest kids would get transferred down to our colleagues either at Spectrum or at U of M typically, but Spectrum tends to be, because they're the closest to us, the most common place we would admit those sick children. But we do admit many pediatric patients to the medical center as well as other hospitals within the system for inpatient care when they need it. It's just those that may need an ICU level or, you know, could get that sick that get transferred. But we are seeing an uptick in the number of RSV patients, COVID patients, and others.
Thanks, Dr. Nafsi. Thank you again to all of our speakers for joining us today. These are really important updates that we will continue, and we will continue with this press conference next week. Our health department experts will not be joining us next week, but they will be joining us the following week again. But again, thank you, Dr. Nefsi, Dr. Morse, Heidi, and Wendy. We really appreciate you taking time and for, again, everything you're doing for the communities out there. I do have two just last slides. Here's a summary of community resources. Again, something that hasn't been mentioned today, but we mention quite often is the 211 resource line is a great information source if you're looking for testing sites or vaccination sites. Again, the area Agency on Aging of Northwest Michigan is also a great resource in addition to all of the local health departments and speakers that just mentioned. And lastly, as a reminder, if you have any questions, whether it's COVID-19 related or any other additional health questions that you're just not sure about, you can call our Ask a Nurse hotline at 231-935-0951. I encourage you to sign up for our e-newsletter that we publish every 2 weeks. Follow us on social media and visit munsonhealthcare.org for the latest updates. Thank you again for all of your questions. If we did not, if you are a reporter and we didn't get to your question today, we will do our best to follow up and get you the answers you need for your stories. Again, we'll see you next week. Please stay safe, get vaccinated, help us with all those infection prevention measures we know work. And together, let's band together to reduce the spread of COVID in our communities. Thanks, everyone. Have a great day.